Hello and welcome to Multiplanner Sectional Anatomy. I'm your professor, Teresa Hodap. I've been working in the medical imaging field for about 8 years. I've worked as an X-ray tech and an MRI tech in various healthcare settings, various shifts, and various places throughout the country. I've been teaching for over 3 years now, both X-ray and MRI. I've worked in Des Moines, Iowa, Houston, Texas, and now Denver. I graduated Clarkson College in Omaha, Nebraska with my associates in radiologic technology and my bachelor's in medical imaging. After working a couple years, I went back to school to get my master's in healthcare administration. So I'm very happy to have you all in class this semester. So don't get overwhelmed with all of the anatomy in your textbook. While all of the anatomy in your textbook is very important, we're going to be focusing on the pathology and the anatomy that's going to be most useful to you in the future as a medical imaging technologist. We can use various imaging modalities to view anatomic structures at different angles or planes. Remember, if you've taken anatomy already, you remember our axial, coronal, and sagittal planes. That's how we're going to view anatomy in this class. We have to know and be able to locate pathology and anatomy from all angles as an imaging technologist, whether that's CT, MRI, ultrasound, X-ray, nuclear medicine, you name it, we need to know our cross-sectional anatomy. MRI, CT, and ultrasound obtain slices of information. So as an imaging technologist, it's going to be our responsibility to locate the anatomy in all of these planes. If we can't locate anatomy, we can't locate pathology, and we're not even going to be able to obtain a picture. So anatomy is very important as a technologist. This class will introduce you to cross-sectional anatomy found in imaging modalities. Future CT and MRI techs, you will be obtaining images in all three planes, and you have to have a strong understanding of anatomic structures from all angles. If you can't locate anatomy, you're not going to be able to get diagnostic images. Then you're going to have an angry radiologist and an angry patient because they're going to have to come back to get a quality scan. They're going to have to come back to get a repeat scan. Future ultrasound techs, understanding your anatomy is also going to be very important. You can't obtain an image of a kidney if you don't know where that kidney is. Also, future ultrasound techs, I guarantee you're going to be wondering throughout the semester, why am I looking at so many CT and MRI images? Knowing how to read and locate anatomy on these CT and MRI images is going to make your life easier. As an ultrasound tech, understanding your anatomy is going to be your top priority. Again, if you can't find an anatomic structure, how do you expect to get an image of it? An ultrasound tech is also going to often compare their ultrasound procedure to the patient's previous MRI or CT scan. This is to get a better understanding of what the doctor is looking for. It's also going to help you figure out how to obtain your scan and what the best way to obtain the scan is going to be. So looking at CT and MRI scans as an ultrasound tech is going to be beneficial for getting the best scan of pathology. For example, there's an order to get a sonogram of a renal cyst. Well, if that patient has a CT or MRI scan of that cyst, you should look at them first, or you're going to be wasting a lot of time just trying to locate that cyst. So looking at the patient's previous scans, if they have them, is going to help you know that the cyst is 3 millimeters in size, and you're going to already know the exact location of that cyst. So that's going to help you determine the best angles to obtain your images before your patient's even in the room. So it's going to save you time, it's going to save the patient time, and it's going to provide the patient with a better scan. So we have a lot of anatomy to cover. You will have a strong foundation. You should have a strong foundation from your A&P class. If you haven't taken A&P yet, it might take a little bit more work to recognize some of these structures. But if you have taken A&P, a lot of this should be review. Overall, this whole sectional anatomy class, it'll be a lot of memorization. I'm not going to take time to review each individual section of the syllabus in this PowerPoint, so please take some time to review that document. There is a quiz and it is due soon. It's worth a grade, so check your calendar, check that syllabus, take that quiz. As this is an online class, attendance will be based on your participation. So if you fail to turn in a weekly assignment or a discussion board or check your announcements or respond to emails, you're going to be considered absent. You should be signing on to D2L and checking your Red Rocks email at least twice a week for this class. Each week, you will have a lecture and quiz to complete by Sunday at 11:59 p.m. No late quizzes will be accepted or graded under any circumstance, so plan accordingly. You have the entire week to complete the quiz and task, Monday morning to Sunday at 11:59. There will be a comprehensive midterm and a comprehensive final exam. There will not be a review. The best way to study for these exams is to review each chapter PowerPoints at the beginning of each PowerPoint lecture and study your old quizzes. And if you have the workbook, that will help you practice for the quizzes and the exams as well. No late exams will be allowed either. Look at your calendar, plan accordingly. You are provided at least 3 days to complete each exam. No quizzes, no exams can be submitted late for grading. You will receive a 0 for these. Occasionally, there will be a few discussion boards to complete as well. These will be graded, and the late policy found in your syllabus will apply for these discussion boards. You must read each chapter. PowerPoints are only a supplement to each chapter. There's a reason why we require you to have that book. You spend a lot of money on it. Use it. There's going to be a lot of pictures in those books that you need to review as well. And since there are pictures in your books, I'm not going to add them to the PowerPoint slides. So those pictures are very important. You do need access to a computer and access to the internet for this class. Technical issues are very, very rare when taking a quiz or exam. Use your best judgment. Make sure you're in a quiet place with sufficient internet access before you're sitting down to complete these exams. No internet access is not an excuse to submit assignments or a quiz late. Contact me if you have problems accessing the computer or the internet. I'll provide you with some resources to use. If your computer is broken, there's lots of public computers. This college has lots of computers for you to use, so no excuses with that. If you experience a technical issue late Sunday nights, you can send me an email. Don't wait until Sunday night at 11 p.m. to complete those quizzes, though. I'll evaluate the situation. However, most often it was found that it was a user error. Technical issues are very rare with this D2L and with the quizzes. Please also note that I can see how many answers you have selected once the technical issue occurs. So I can see if you've completed all of the exam. when that technical issue occurred. PowerPoints. Hopefully by now you've found out how to listen to the PowerPoints. But if you're just reading them and you said, what, there's audio, click that little sound icon in the corner of your PowerPoint slide. Most of the time it's going to be found in the lower right hand corner. You can also put these PowerPoints in presentation mode, and that's going to automatically play the audio for you. As I mentioned earlier, this class is going to start off as just memorization. So experiment with a few different ways to figure out what the best way to understand the anatomy and to locate all of the anatomy on your imaging planes. So I recommend taking a blank note card and covering up the side anatomic words so you just see a blank picture in front of you with some lines. Go through, see how much you know. Practice, practice, practice. If you've purchased a workbook and it's not a requirement, it is just recommended, that workbook has some great images to practice with as well. Find a partner in class to study with. There's going to be discussion boards where you can all communicate. Study a little bit every day. You can't memorize this and be successful at Sunday 10 p.m. You have to start Monday when these exams open. Or start Monday when the lectures open. To review the material. Take a peek at the chapter for the following week. The calendar is all laid out for you. Read the chapters. They look long, but once you start reading, you'll realize it's mostly pictures. And the text is pretty easy to follow as well. It contains a lot of critical information, your chapters do. This is an intense class. It's preparing you for being successful in the imaging field. We cover a lot of information in a short amount of time. You will not be successful in this course if you wait until the last minute to study, or rely on your notes when you're taking the quizzes and exams. There are time limits for those, so you can't look up every question. And this is actually information you're going to need in your profession. So don't just pass this class and be done with it. This is actual information that will be required for you to understand to be successful in this field. If you have any questions throughout this course, my door is always open. Come on in, come visit me on campus. I do recommend calling or shooting me an email first just to ensure that I am there. Don't want you to waste a trip to campus. There's also a discussion board that's always going to be open on D2L. If you have questions about a quiz, PowerPoint, or something in the book, this is actually the best place to put it. Chances are you're not the only one that has that question. I do check that discussion board every day or every other day, and I'll respond back to you. If the question is about a quiz answer, I will not respond to that quiz question until the quiz has been closed. So please understand that if you do have a question wondering why you got something wrong on a quiz, that I will not respond to that question until the quiz has closed, so Sunday after midnight. Well, welcome to the class. I'm very happy to have you here. It's going to be a busy next couple weeks, but I know you all can do it, and I know you can all be successful in this class.